breast augmentation, we do hundreds of them a year. It's a popular operation. A lot of our staff and a lot of our families have had breast augmentation. So what happens is you come in and you want a better shape and a bigger breast. Mostly what breast augmentation does is it gives you a bigger version of the shape that you have. So if your shape needs to change significantly, you probably will need some type of a mastopexy or breast lift. When you come in, what we do is we talk to you, examine you, listen to what you want, and see if we can make it work and give you what you want. We measure your breast to make sure that the implant that you choose will fit into the pocket. If for instance, if you choose an implant that's too wide, then it could be in your armpit, or it could make a uniboob, or it could wrinkle, and it can make the implant fail. So we have to make it fit. We warranty our breast implants and the operation and the results for 3 years afterwards. What that means is that for a capsular contracture or a malposition of an implant or things like that, if we have to reoperate on our patients, we charge them $0. In other words, we control the costs of our operating room and everything, and so when patients come back in, they rarely will need any revisional surgery, but if they do, it doesn't cost them anything. The only thing that we don't warranty is that if you have an excellent result and they would like to change the size of their implants, then what they get charged is the wholesale cost of the implants and the OR and anesthesia and no surgeon's fee. The silicone implants right now, our fee charge is $6,900. That's for a silicone implant. For a saline implant, it's less expensive. It's $5,900 because the saline implants are essentially $1,000 cheaper. The implants cost us somewhere, I believe, between $1,900 and $2,000 of that cost for a silicone breast augmentation. Other things that go into it are the cost of the operating room and the anesthesia. There's all the products and the sutures that we use, and that adds to the cost of it too. It generally takes about an hour's worth of anesthesia. The anesthesia charge generally for our operating room is about $800 an hour for the OR and the anesthesia charges. Other things that go into the cost of procedures in general are, well, how good or experienced are our nurses. You know, nurses right out of school are way less expensive than experienced nurses, but we want experienced staff. We want experienced anesthetists. For instance, our anesthetists all have between 12 and 15 years of experience. I can get a less expensive anesthetist, you know, right out of school, but I don't want one. And so when you come here, I'm going to give you the very best of everything that I can give you. But I have people every day that come in and they're looking for the least expensive plastic surgery. Well, number one, make certain that your plastic surgeon is a real plastic surgeon and is board certified by the American Board of Plastic Surgery. There is no other such thing as boarded by any other board except the American Board of Plastic Surgeons, who's a real plastic surgeon. You can always find someone to do it less expensive. It's also a safety issue. You know, I mean, we are AAA HC certified. That costs money. You know, we have our own operating rooms. That costs money. We have our own department of anesthesia. You know, we don't go to the hospital to do our operations. And the reason we don't is because the hospital has to do everything for everybody. We just do this. All we do is cosmetic surgery every day, all day long. And so you get really good at what you do, just like the hospital has to do all those different operations for the different surgeons. Not here. We just do it here, and we're good at it. Go ahead and hit the like button if you enjoyed this video, and subscribe to the Austin-Weston YouTube channel to stay up to date with the latest in cosmetic surgery. For more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.